Have you ever found that your periodontal treatment isn't really working and your patients go on to lose their teeth? Today we'll be covering our top 5 reasons why that might be the case. Hi everyone and welcome back. Today I am honoured to be joined again by the amazing award-winning dentist Dr. Anushiravan Aryakish, who's the director of the award-winning practice White Rose Dental Studio and has over 25 years of clinical experience with a master's in periodontology and a special interest in the diagnosis and treatment of peri-implantitis.
Thank you for having me again, Zoe. It's nice to be back in your studio making useful content for other dentists and dental students. Today we will be going through the top 5 reasons why your perio treatment might be failing.
Let's get into it.
The first reason why your periodontal treatments might be failing could be due to insufficient treatment. There are multiple reasons why you might be failing to provide the best treatment, and we will go through them now.
The amount of time and effort spent on a patient with periodontitis is very important. A full periodontal assessment can't be done in less than 60 minutes. It's not something that can be squeezed in between patients. Appropriate radiographs must be taken, fully assessed and reported on.
Intraoral photos should be taken before and after disclosing tablets are used to be able to visualize the plaque retentive areas for both the clinician and the patient. Full mouth pocket charting, plaque scores and bleeding scores must be done at the onset of the treatment. Also, a full medical, social and dental history should be taken to highlight risk factors like diabetes and smoking.
A periodontal chart including plaque and bleeding scores should be referred to during the periodontal treatment to make sure appropriate and enough debridement is carried out for each surface of the teeth. A particular site with a deep pocket, extensive bone loss or plaque retentive root anatomy may need a very long time spent on for sufficient debridement.
Another one of the causes of treatment failure is insufficient debridement due to the lack of knowledge about tooth anatomy and lack of attention to the established periodontal depth. Familiarity with the instruments for periodontal treatment is also very important. Use of the correct instrument for every surface is crucial, and the clinician must be able to assess efficiency and quality of the instruments. One basic reason for inadequate debridement and treatment failure is lack of attention to the active or perhaps not so active worn out tips of the instruments used in the treatment of periodontitis.
The second reason why your periodontal treatment might be failing is because of local risk factors. These could be due to overhangs, vacations, limited mouth opening, crowding, or even restorations with poor designs.
Overhanging fillings or crown margins of different sizes will harbor plaque and food particles, preventing the patient from full and effective interdental cleaning. Furcation defects can be practically impossible to reach, even with a clinician's professional tool, prohibiting effective plaque removal and therefore facilitating the fast progression of the periodontal disease.
Some patients will present with limited mouth opening, making it difficult to reach particular parts of the mouth, especially at the back. Patients might also present with severe crowding, which will prevent them from brushing effectively, and others might present with partially impacted wisdom teeth, creating a niche for plaque retention, bacterial growth and bone loss.
The last thing to be aware of when it comes to local site-related risk factors is the fabrication of a prosthesis with a poor design, which can also be a factor that, if not corrected, will lead to the failure of the periodontal treatment through plaque retention and cleaning difficulties.
The third reason why your periodontal treatment might be failing could be due to a particular medication which your patient is taking. Certain medication taken by the patient may cause gingival overgrowth, which creates the space for the bacterial biofilm to grow and further deteriorate the periodontal status via inflammatory reactions from the host.
Here comes the importance of accurate medical history taking and a good knowledge of the medicaments that can affect the gingival tissues. The first line of action is to contact patient's doctor in writing to discuss the possibilities of replacing a particular medication with another that would not have an effect on the gingiva. At the same time, a thorough scale and polish and subgingival debridement should also be carried out by the clinician.
The fourth and most obvious reason why your periodontal treatment might be failing is because of the lack of good oral hygiene from the patient. This could either be due to the clinician not spending enough time educating the patient or due to a lack of patient compliance.
As you already know, the plaque and host interaction causes a change from a state of periodontal health to periodontal disease. If the patient is not aware that it is actually plaque that is giving them all their gum problems, or if the patient doesn't know how to effectively remove the plaque, then you cannot expect their periodontal health to improve.
Patients must be informed about their important role in the succession of their gum disease treatment. It is very important to establish the patient's understanding that the maintenance of their gum health is in great part achieved by the efficacy of their teeth cleaning at home.
Oral hygiene instructions is not a one-size-fits-all exercise. Patients' periodontal status should be assessed tooth by tooth and a care plan devised for each sextant of the jaw. There are various spaces with different sizes between the teeth, and if the clinician doesn't spend enough time to establish and demonstrate the most appropriate interdental cleaning aids along with the correct sizes to be used for each space, the patient will not be able to efficiently perform the interdental cleaning, leading to treatment failure, progression of the gum disease, and ultimately loss of teeth.
TP has a very useful mouth map you can use to record the color of brushes the patient needs to use for each space. Give this to them to take home, as patients often forget. You also need to explain that as their gingival inflammation reduces, they need to use bigger brushes for the gaps.
If you spend all the required time with the patient and they simply don't listen to the advice you are giving them, ultimately the periodontal treatment will fail. The evidence in the literature shows us that approximately 50% of the patients fail to comply with the oral hygiene instructions given by the clinician.
A way to improve the success rate of your periodontal treatment is by taking intraoral photos when you first see the patient, at 4 weeks and at 3 months, to demonstrate the lack or presence of oral hygiene compliance visually to the patient.
Additionally, regular attendance for professional tooth cleaning by a dental hygienist is crucial not only for the cleaning itself, but also for reinforcing oral hygiene instructions and motivating the patients. In addition, this allows us to re-evaluate the risk factors such as a patient's smoking status.
You can also check out the video we did on giving oral hygiene instructions. We'll put a link for that in the description.
The final reason why your periodontal treatment might be failing could be due to the complexity of the case. A common reason for treatment failure is the level of experience and insufficient knowledge of the periodontal disease evaluation.
The clinicians should be able to establish the correct diagnosis and understand whether management of a particular case is within or beyond their expertise. Simply doing deep scaling, oral hygiene instructions, and hygiene referral is often not enough to manage a patient with gum disease.
The clinician must be able to reassess a patient with a periodontitis in set intervals and inform the patient about the possible progression of each periodontally involved site, in addition to discussing further options, for example, surgical periodontal treatment or guided tissue regeneration. You should never practice outside your scope, and instead it would be wise to refer to either a dentist with a special interest in periodontology or to a specialist periodontist.
You can check out page 41 of BSB's Good Practitioner's Guide to Periodontology to see which cases they recommend a referral for. We'll put a link for that in the description. So that was all for this video. Thank you so much, Dr. Aryakish, for joining us again. We appreciate you giving your time and knowledge.
Thank you very much for the opportunity.
If you haven't already watched our other video together on what every dentist should know about implants, feel free to check that out. We'll put a suggestion here. And if you found this video useful, make sure you subscribe and give us a like, and we'll see you in the next video. Take care.